Welcome to the Vision Quest video series, a step-by-step guide to holistic health. This program will discuss chiropractic therapy. Hi, my name is Toni Gallardi. I'm a psychotherapist, talk show host, and writer. I've been working with people in adult transition and crisis for about 15 years. I did a talk show for 2 years called The Toni Gallardi Show that interviewed risk takers, people who had left chaotic lives and impassioned their lives with brand new vocations. And then I went on to start a book called Lifequake, which is all about a 7-stage map to a whole new way of being an adult. We'll be talking about the origins of chiropractic therapy. Some say it goes back thousands of years. Modern chiropractic therapy was invented by D.D. Palmer in the late 19th century. We'll also be discussing how chiropractic therapy is used, such as with poor posture, subluxations in the spine, and appropriate kinds of treatment.
The term chiropractic is derived from the Greek words chier, meaning hand, and praktikos, meaning concerned with action. The aim of chiropractic treatment is to restore the normal function and integrity of the spine, allowing the release of any pressure on the nervous system and thus allow healing to occur and pain to subside.
Chiropractic therapy, chiropractic, is a branch of the healing arts that specializes by the use mainly of spinal manual therapy, that specializes in the removal and diagnosing and removing of biomechanical disorders, which we call subluxations, which by their nature have neurological consequences, the removal of these subluxations from a person's spine.
The chiropractic approach to health is to examine the spine and to determine whether there's a structural problem with that person's spine and the way it's actually functioning. We stress the importance of the nervous system and how that nervous system relates to the function of that spine. We are very interested, of course, in the rest of the body. Holistic aspect is most important from a chiropractor's point of view, and we want to find out information about that patient's lifestyle, type of work they may do, examine their posture, if there's various stresses that are occurring at home, and perhaps even the way they sleep may be affecting the way their spine functions. But what we do is examine their spine with a technique called motion palpation to determine if there is some restriction in those joints. And if there's apparently problems, we'll certainly do more investigations. Quite often we'll take x-rays of that person's spine, and usually we'll do that standing up, because we're interested in seeing the structural effect and what gravity can do to that person's spine under a postural loading situation. Then, once we've developed those x-rays and ruled out any serious pathology, which would entail us to refer to the appropriate specialist, if there's nothing to worry about in that serious respect, then we will accept that patient and begin to explain what the problems are so they can understand the rationale behind adjusting the human spine or unlocking these joints to release any potential problems with either the joints, the nervous system, or the associated discs and muscles. The organs seem to have a relationship as well to how well the spine works, but research is still not explicit enough to give us enough information as a direct cause and effect, but we're working on it.
Chiropractors make adjustments to the spine using two methods called mobilization and manipulation. Mobilization is the shifting of a joint within its normal range of voluntary motion, while manipulation is the shifting of a joint outside its normal range of voluntary motion. Both mobilization and manipulation are forms of spinal manipulative therapy which aim to restore an abnormally functioning joint and its associated elements to function normally. Manipulative therapy requires considerable skill by an experienced chiropractor to be able to control each joint to be effectively and painlessly adjusted.
Yes, there's over 200 different types of chiropractic styles of treatment available in the world today. Most chiropractors might use 8 or 10 or 15 of those particular ones and do the styles of treatment that best suit those particular patients that they may see, or perhaps that particular chiropractor themselves.
What are some of the examples of those styles?
Well, traditionally chiropractors perform adjustments to the human spine. That is an unlocking of the joints to free them up in an attempt to help the nervous system and help the body to work as well as it can quite naturally. Keeping in mind that we take x-rays in most cases to determine if there is a structural problem first before we decide exactly what type of treatment that we'll be doing. But many different types of treatment do not even actually have any noises associated with them. Sometimes there is a little noise of the joint unlocking, and that can be a little fearful for a patient, but quite often there's no serious problems with that.
Chiropractic is fundamentally the same thing, although there are very many different schools or techniques that are employed to accomplish the same goal, which is basically to restore the alignment and the function to the spine and remove any nerve interference that may be associated with that. As I say, there are numerous techniques that suit certain individuals more than others, but they all accomplish the same goal, which is basically to remove the nerve root interference or nervous interference, and also correct the mechanical disorder from the spine and peripheral joints.
Chiropractors are usually associated solely with the treatment of back problems. However, many problems associated with the back may cover not only the back area, but the neck, chest, arms, legs, hips, knees, ankles, wrists, or shoulders. Essentially, the chiropractor is skilled in treating muscle or joint-related problems wherever they may occur in the body, which are linked via the nervous system. The most common problems which chiropractors may address include scoliosis, or an abnormal curvature of the spine, headaches and migraines, which may be caused by neck strain, growing pains in children, lower back problems, pain between the shoulder blades, sciatica, which may cause pain down the back of the leg from pressure on the sciatic nerve, frozen shoulders, or sports injuries.
One of the most common things that we help is neck aches, lower back pains, sciatic nerve problem. That's the nerve that comes from the lower part of the spine and goes down the legs. That can be a tingling and numbness. A sharp stabbing pain is the most classic style. But any sort of nerve irritation like that, we're of course very interested in examining. There's problems that can relate to the chest region. Some people actually get pain coming around and mimics a heart problem, and this is one of the areas that we're of course quite interested in. The thoracic spine has nerves that go around right through the rib region to the front, and that can be quite confusing for a lot of people. We've helped a number of them who have felt they've been having heart problems, have been checked over by the hospitals, had their ECGs, and are completely cleared, and I've had a few referred directly to me because they've been told that it actually must be a pinched nerve coming from their spine.
Some common problems that people will come to see a chiropractor with, I guess most commonly, neck pain, shoulder pain, pain between the shoulder blades, lower back pain, are probably the most common reasons that people go to see chiropractors. But from these three areas, for example, the neck pain, a very common symptom that comes from that are headaches, which is a referred pain from an origin in the neck. It's very common, as you know, headaches. Some of the other common things from the neck would be dizziness, loss of balance, just feelings of ill health. Pins and needles, numbness, tingling, pains running into the arms, elbows, peripheral joints. A lot of peripheral joint problems, when I say peripheral joints, I mean fingers, wrists, elbows, shoulders, ankles, feet. Peripheral joint pains, fleeting peripheral joint pains, are often caused from a lesion back in the spine, the sort of subluxation that chiropractors treat. Other things that chiropractors treat commonly from the mid-back, a very common referred type of problem would be chest pain, shortness of breath. The mid-back, because it shares the same source of nerve fibers as many of the organs like the heart and the lungs, conditions such as respiratory conditions such as asthma respond beautifully to gentle chiropractic adjustments. Not all cases of asthma, but many do. Not only because it releases the muscular tightness that restricts the chest when a person tries to breathe, but also the nerve supply to the lungs and the bronchi originate from between the shoulder blades, and a misalignment in the spine may irritate those nerves and produce the symptoms of asthma. Indigestion, functional stomach disorders can all be traced back to the spine. Again, for the same reason that the mechanical area of the spine shares the same source of nerve supply as many of these organs. And many functional organic problems are relieved very, very much by chiropractic treatment to the spine. As we move further down into the lower back, I said lower back pain was a very main cause for people seeing a chiropractor. Probably the most common referred symptom from that is leg pain. People often call it sciatica. That is the most obvious, but you can get variations of that. Sometimes you will get people with pain in the groin, sometimes in the abdomen. Many pelvic disorders and many conditions that simulate appendicitis, almost identically, have been treated for those organic conditions. People have had their appendixes removed, and it's actually been their spine that's been out of alignment. It's only been later on, when they've seen a chiropractor, that that's been diagnosed. Some of the other things that the lower back can contribute to: pain in the testicles, problems with sexual function, foot and ankle pain. Conditions. Some conditions respond quite dramatically. I've had cases of young children that have had just heel pain, nothing else, no back pain. And I've traced it back to the sacroiliac region. And an adjustment and a correction of that sacroiliac joint has eliminated heel pain has been long-standing of 5 and 6 years in young people. Cases, as I mentioned earlier, about pelvic and abdominal pain in women, difficulty with their periods, painful periods. All this can be traced back to the spine. Now, not every case is, but a great many are. And it's much better to have your back checked and corrected first and eliminate that possibility as a cause of your problem before you progress to more invasive medical procedures, which may be dangerous, especially if they're not properly, they're not necessary in your condition. As I say, I had a woman, and not many cases of this, but most recently I had a letter from a woman who had pelvic pain. And she was told it was her ovaries, then she was told it was her kidneys. She was hospitalized for kidney stones. She came out of the hospital. This preceded by a little bit of a back injury, but she didn't have back pain. She went to see a very, very well-renowned orthopedic back specialist who told this woman that she had one of the best backs he had ever seen in a woman her age. Now, it was only fortunate that this woman had a daughter who had seen a chiropractor. And she went off to see a chiropractor and for a neck problem. And while he was treating her neck, he said, listen, he says, you've got a little bit of a problem in your lower back. She said, well, she didn't feel any pain. He adjusted that and corrected that, and her pelvic pain went away. Now, the problem is, this poor woman had been told by a medical specialist that she had one of the best backs that he had ever seen. And yet a chiropractor, who wasn't even treating her for that condition, relieved her problem because he picked it up coincidentally when he was treating her for another condition. Now, this woman is left in a quandary. She says, who do I believe? You know, where do I go for help? And this is really the essence of part of the problem. If you have a chiropractic problem, unfortunately, because of the way people are trained, only a chiropractor can tell. It's such a specialized field of therapy that it's unfortunate that Orthodox medicine isn't trained as well in this area because they're missing a lot of cases that have a chiropractic origin, which they would not be able to diagnose because they lack those skills. And as I say, unfortunately, chiropractors are the only health professionals necessarily equipped by their education to carry out diagnosis and treatment of spinal biomechanical problems, like I've talked about, and their subsequent neurological sequelae.
The use of manipulation has been documented as far back as 2700 to 1500 BC in China and Greece. The first person to link spinal misalignments with ill health was the physician Hippocrates during 400 BC. During the 18th and 19th centuries, spinal manipulation, then known as bone setting, was very popular, and to this day there are still persons practicing as bone setters in Britain. The technique of bone setting was handed down from father to son, which usually had no formal medical training. The founder of modern chiropractic therapy was D.D. Palmer, who lived in the Midwestern state of Iowa in the US. Palmer had no orthodox medical training, however, did have a keen interest in anatomy and physiology, with emphasis on the spine as a possible cause of disease. In 1895, he was said to have cured a janitor of deafness by merely adjusting a vertebrae in the man's spine. In 1907, B.J. Palmer, David's son, took over his father's infirmary and continued the development of chiropractic. By the time he died in 1961, B.J. Palmer had made chiropractic therapy the second largest healthcare therapy practiced in America, which today still ranks as one of the most popular and economic forms of treatment available. Many lower back, neck and shoulder problems are a result of poor posture. Poor posture may also cramp the internal organs and affect the way in which they function. For instance, cramping the chest cavity may affect the breathing, while cramping the stomach and intestines may affect digestion and bowel movements. The following is a list of common causes of poor posture: bodily laziness when in the upright, sitting or in lying positions, lack of exercise and muscle tone, occupational stress and poor working conditions, which may include bad sitting, injuries or pre-existing spinal problems, sight and balance problems, weight problems resulting from bad eating habits or lack of nutrition, foot problems and bad shoes, or a negative attitude towards life.
Chiropractors traditionally use their hands only and usually don't use any other pieces of equipment. And the traditional approach to spinal subluxation, or that stiffness that we were referring to earlier, is to just use the hands to gently yet firmly unlock the joint, to release any pressure within that joint, and perhaps take pressure actually off that nerve that might be irritated right next door to that particular problem. So it's usually done hands on the spine, usually not too much in the way of any machinery, as opposed to perhaps other forms of therapy or other professions. A normal spine is an interesting question, because normal is different for every one of us. It's like snowflakes. They may all look the same from a distance, but every single one of them is different. A spine should be reasonably flexible, though, and there should not be any interference to the nerves coming from that person's spine. Now, a spine is supposed to be reasonably straight from the front to back view, or back to front view. And the side view, there are three main curves, and then the extra curve of the sacrum and coccyx at the bottom. Now, those curves have certain parameters that they can work comfortably within. If they become too much out of that position, then more pressure can build up on the joints, ligaments, muscles, and perhaps even irritate those nerves. But a spine does not have to be perfectly straight from the back view or perfectly curved from the side view to function quite well. And on the other hand, we have patients who have perfectly normal looking spines on x-rays, yet they complain of a lot of irritation, pain, inflammation because their joints or perhaps even their nerves or muscles are not functioning the way they should, even though they may look normal just from the point of view of an X-ray. It's basically how flexible, how well that spine is performing in a dynamic sense that's far more important than just what it may look like.
Conservatively, 80% of the population plus suffer back pain at some stage in their life. So this gives us a pretty good idea that probably most people that have been born and that are living have a potential back problem of some degree or another. As I say, the spine is a series of over 20 movable segments that all have to be functioning normal in the right position and moving in 6 different ranges of motion, all normally, all the time, for it to function optimally. And because of our nature of our life being sedentary often, where we're sitting all day long, not getting exercise, congenital problems which we're born with, all these different factors, knocks, bumps, and falls, all these different factors can contribute to throwing the normal balance and harmony out of the spine. And consequently, almost everyone has a spinal problem to some degree or another and could benefit from a chiropractic treatment and assessment in particular.
Nerves are extremely important in relation to the spine. Research is starting to show now just how important that is. A very, very slight bit of pressure on a nerve can actually cause an alteration in that nerve signal. And it's still being proven just how much pressure it really does take. But if there's a pressure building up, be it from an actual physiological pressure or a swelling or a disc bulging up against that nerve, that will affect the function of that nerve.
Basically, pinched nerve is...
Hence the term pinched nerve, that's correct, yes. And a nerve can give trouble but not necessarily give symptoms right away. And this is the controversial part of chiropractic. Often there can be some pressure building up, much like, say, a cavity in a tooth. You've got your enamel, the dentin, the pulp, and the nerve root. You'll only feel the symptoms on that tooth when that cavity actually gets right down into that particular nerve. Whereas when there's a spinal problem, there can be mechanical problems going on for many, many years, even degeneration showing up on an X-ray, and the symptoms may still not be evident for several more years. So we're of course very interested to determine whether there could be a malfunction of that spine even before there's some serious effects. Now what we do to begin with usually is have this patient lying down and check the relative leg length, just as a rough estimate to begin with, and that helps us determine what's happening up in the pelvis and the lower back region. We'll also do some reflexes, for example, this one on the sole of the foot, the Babinski reflex. We'll also do the Achilles reflex as we tap on the Achilles tendon. And then we'll look further up to the pelvis, the lumbar spine, and get some idea of the flexibility in that part of the body. We'll also often use a pinwheel, this little device here, and that determines whether the patient can still feel things properly on each side of the body. We check for the flexibility of each individual vertebra, going up it and down it, to find out if there's a possibility of some restriction which could translate into malfunction and perhaps even some pain that could be developing or symptoms that could be developing in the future from this particular restricted joint level. Now, when we have the patient lying on their back like this, one of the tests that we often do, of course, is the patellar reflex. This is another one of the tests that we do to determine the integrity of the nervous system in the lower spine and how it's relating messages down the leg. We also check further up into the neck region, and using this technique called motion palpation, we determine with our fingers pressing against the vertebra the amount of flexibility and the ease of movement between each of these segments in this part of the spine. When we feel that there is an actual joint restriction, that makes us a little bit suspicious of a problem. And that's an area that we're going to spend more time looking at when we look at the X-rays as well.
Most chiropractors use X-rays of the spine to determine the most suitable type of manipulative techniques needed to correct a particular problem. Some people's backs are particularly misleading and look quite normal from the outside. However, an X-ray can be a very accurate way of revealing spinal degeneration, wear and tear, or curvature that would have otherwise have been extremely difficult to detect.
Now this X-ray is of the lower lumbar spine, and we're going to put this compression bandage around the patient to keep her in position, but also to slim down the stomach region, and that will allow us to use even less radiation to get a more effective photograph of her. You'll notice that we're still taking these pictures standing up because, again, we do want to see the effect on this person's spine of gravity and what they think is reasonably normal posture. We collimate with our X-ray unit to narrow down to make the most efficient picture that we can of this patient using the least amount of exposure. We also take these X-rays at a 200 centimeter distance away from the patient, which will give us approximately 1/4 the amount of radiation that she would otherwise receive. So we're very aware of reducing radiation factors to our patients.
An adjustment is a chiropractic term for a specific manipulation of the spine to correct the misalignment or abnormal function of the spinal column and peripheral joints, and then thereby to restore the function and to relieve and release any nervous interference that's caused from that. With the spinal adjustment or the chiropractic adjustment, there's most commonly associated a little bit of a pop, like this. Okay? Now that pop that's associated with the adjustment is not associated with anything breaking or cracking or rubbing. That's purely a gaseous phenomenon. Just like going, as the joint's manipulated or adjusted, there's a quick separation of the joint surfaces, and because the joint has a tight capsule around it, it forms like a little, it's like a pressure capsule. And as that's manipulated and corrected quickly, there's a release of gas bubbles that produce the noise. But the noise is not associated with any breaking, cracking, or pathological tissue reaction.
Right, when a patient is lying down on their stomach and we're about to do our examination, we do the leg length examination first of all to determine if there is any of that tilting that could be affecting the way the hip functions or the pelvic region, and that in turn can translate into problems going further up the spine. There's often a domino effect, as one part of the spine can affect the next, which then affects the next region. So it's important to look at the spine from a total point of view, just as we do a holistic understanding of a patient. Now, an adjustment is a very simple procedure and usually very, very painless, but sometimes has a little bit of a noise to it. And that noise is simply the joint unlocking or popping apart as it's released from its state of rigidity. An adjustment is performed to improve the function of that part of the spine and to relieve any pressure that may be building up around that particular joint, which could translate into nerve irritation or muscle problems or even ligamentous problems.
Some people think that chiropractic is painful, and most of the time it's not. A lot of the structures along the spine are pain non-sensitive structures, so you can actually go in there and manipulate them without creating pain. It's very safe and conservative, and the only time a person will actually get a little bit of pain maybe if they've got a severely degenerated or damaged joint. But it's a pain. It's a very mild pain usually. That's more associated with that particular condition. Pain is a perception. It's not a sensation. And because chiropractic care is different, and it's hands-on, and it sometimes seems to a person to be fairly vigorous, it doesn't mean it's painful. People tend to perceive that as it should be causing pain, but if they actually understand what is happening to them and they do what their doctor tells them in terms of relaxing and breathing before the adjustment, they'll find that it actually, in essence, really isn't painful, but they feel vulnerable. And it's important for them to understand what's happening to them, because if they understand that the vulnerability is not actually painful, they'll then get a better result with their adjustment. Sports chiropractic is a very exciting area, because as sports chiropractors, we don't emphasize just treating an injury. Because of the fundamental correcting the cause nature of chiropractic therapy, by correcting the cause and problems in the spine, we can actually assist athletes to improve their performance. And from my experience over 15 years, treating with national teams and looking after world champion athletes, I found it more the rule than the exception, that chiropractic intervention with these athletes at critical times has a phenomenal effect at improving their ability to perform. One very well-known beneficiary of sportsman that was a beneficiary of chiropractic therapies probably summed it up best before the '76 Olympics. He said, chiropractic enhances the athlete's ability to realize their true potential. And basically, as a sports chiropractor, what we look at is posture. Okay, as I say, sports chiropractors, evaluate. One of the things is an athlete's posture. Not only their posture in relation to how they sit and stand, but their kinetic posture, their posture doing movement in sport. And as a sports chiropractor, we feel if we can improve their posture, we can improve their performance. So it's all about posture. And as I say, sports chiropractors and chiropractors in general are the only health professionals that are trained specifically to evaluate the biomechanics and the posture that's involved in these sort of situations. Sports people suffer slightly different problems than ordinary people. They undergo more stress and practice, and so they tend to suffer stress-related injuries. Okay, that's a major difference between the average person and athletes. But we can learn a lot from athletes and apply it to not normal people, but to the average person who's not an athlete. And by examining and learning stress-related injuries, we can then treat these athletes better. And a sports chiropractor, or any doctor in general for that matter, can't really treat a sports injury or stress-related injuries unless they understand the basic mechanics of posture, as I said before, because posture underlies all these stress-related injuries. And common sports-related problems that people have it's very sports-specific, first of all. But if we take, for example, running, which is a very common activity that a lot of people do, running is a very stressful activity, and unless the alignment, the leg length, and the alignment in the pelvis and lower back, for example, is correct, and the joints at the base of the spine and all the joints through the hips are moving properly, running on a repetitive basis can actually traumatize and stress those joints. And as a sports chiropractor, we find that one person's sport, or even for the same person. A sport can be either good health and good therapy, good medicine, or else it can be very harmful. And the difference is depending on how that person's spine is aligned and functioning at the time. For example, if a person's lower back is out of alignment and they go running, the constant repetitive trauma and stress to their back will cause problems, inflammation, further misalignment, and eventually things like degeneration. If that person sees a sports chiropractor, they may not have pain, but they may have joint misalignment, which is another thing I'll speak to later. If that person sees a sports chiropractor, has the alignment and the function restored, that person can then go out and run, and that running will reinforce the corrections and help keep the spine free and mobile. So the same activity can be detrimental or it can be very beneficial depending on the function of and alignment of the spine and peripheral joints. So in summary, with our patient today, Matthew, I'd just like to say, he filled out a basic questionnaire first of all, so that we could get some sort of preliminary idea of what his problem was. We then spent some time speaking with him and consulting with him to find out, localize his problem more and find out any of the associated details that may be relevant. He was then examined completely. Proper physical examination, postural examination, orthopedic and neurological examination. At that point, it was discovered that I felt that he required x-rays, so x-rays were taken as well. X-rays are very important in helping to diagnose problems. Not that chiropractors training to feel isn't effective, but you can't feel everything, and there are certain congenital anomalies which did show up on his x-rays, which you can't feel, and are very important to know the blueprint of the spine before you actually treat it. Matthew has a sporting injury, but he's also an adolescent who has that extra stress of going through rapid growth periods. And it was a classic example of a young person that really required and benefited from chiropractic care. His bones are growing faster than his muscles, and consequently that's throwing his spine out of alignment. And as he takes that misaligned spine and puts it through the rigors of sport, particularly ice hockey, which is like football and other contact sports, susceptible to spinal problems, he is aggravating the problem even more so. So with Matthew today, we were able to show how chiropractic can evaluate a sports person and how we can actually, and also a young sports person, and the benefits to not only to improving his performance and taking away his pain, which is often why they initially come into a chiropractor, but educating him that through the treatment, he's actually improving his performance and preventing this from happening again. So his pain from the sports being relieved, his condition through adolescence is being corrected, and his nervous system and overall spinal health and balance is being improved for the future.
There are many different types of headaches, actually, as you can imagine, migraines and cluster headaches and allergic reactions and so-called stress headaches. But the headaches that chiropractors are finding quite good results with are the kind that seem to just build up pressure on the joints on the upper part of the neck. There are nerves up there, the greater occipital nerve specifically, seems to be one of the ones that's most involved with this particular problem. And if there's a restriction of the joints right next to that, or an inflammation, or even the muscles getting very, very seized up and tight, then that in turn could be affecting the function of that region. And hence you can get a referred symptom around up over the head. And specific adjustments often relieve that pressure. The side effects of chiropractic therapy are usually simply feeling better. Chiropractors are extremely well trained in spinal adjustments. In fact, several studies around the world have shown that chiropractors are the professionals who are the best trained for spinal manual therapy or adjusting of the spine. There are very, very few problems. Of course, no procedure is absolutely 100% risk-free, but the chiropractic safety record is exemplary. In fact, you can ask malpractice insurance people about this, and you'll certainly find out that chiropractors enjoy about the lowest malpractice insurance of any profession. And if there was a problem, that would be the first area to look to.
First, I'd like to say that modern chiropractors are extremely highly trained doctors who are trained to carry out spinal manipulative therapy and diagnosis at a very sophisticated and a very refined level. In fact, one of the major magazines in the United States a few years ago did a study. They wanted to find out which health profession required the most manual dexterity and skill. And they found that to practice chiropractic properly required more and a greater neuromuscular dexterity and skill than to perform major surgery. So a modern chiropractor is trained very highly in the use of their hands and feeling, but they're also academically trained to a very high level. It's a minimum of 5 years of full-time training, which is comparable or more to the average medical person. So they're very well equipped by their education and training to carry spinal manipulative therapy.
We must emphasize that even with the exercises that we give our patients, there's no one exercise that's good for every single person. So we certainly try and tailor the treatment and the extra activities that we'll have our patients do to their particular problem. Every spine being a bit different does need different types of treatment by the chiropractor. Certainly when we treat our children, we treat them much, much differently than we would someone who may have a little bit of osteoarthritis, or a person who could be in their 70s, 80s, or even 90s, and who could have some osteoporosis, some thinning of the bones. We have to be careful with all of these conditions, and chiropractors are very careful. Medical opinion these days is getting better and better. We're finding a lot of the medical people are actually trying to learn to do chiropractic treatment themselves. Sometimes they might call it medical manipulation, but it's along the same lines. The biggest difference seems to be in our approach with the way we take our x-rays and the specificity that we feel is very, very important. We don't think that a general approach is good enough, and a chiropractor spends at least 5 years of full-time study to learn how to do this particular procedure, spinal adjusting, along with the diagnosis and pathology and everything else that goes along with the course. The medical doctor does a very similar course, except spends more time on drugs and surgery. Chiropractors spend more of their specialty in adjusting the spine, learning how to free up these spinal problems, and of course learning about x-rays as well. So it's very similar, the two professions, but chiropractors choose not to use drugs or surgery in their approach.
I alluded to earlier, I said that if you have a chiropractic problem, only a chiropractor can tell. And I guess our approach can be summed up by, we look at the same problems through different eyes. What I mean by that is, if we take a back problem and we look at it from a medical point of view, medical profession is generally trained to look straight in at the problem and isolate and localize and find out exactly what is the pathology of that local area. Chiropractors also do this. We're also trained to diagnose the local pathology and problem. But we're also trained specifically to see the interrelationships of the whole. Okay? So we tend to diagnose, first of all, for example, the local pathology or the local problem in the back. Then we see how that pathology is affected by the overall structure, and how the overall structure is contributing, causing, and affecting that local problem. And many times, because of the inherent nature of the spine and its ability to refer pain and cause distant problems, it's very important that we look, especially with spinal problems, from a distant view and a local view. So we have the benefits of looking at the total person and to see how that total person's affecting that local problem.
Chiropractors give a variety of exercises. We tend to aim more at increasing the mobility as well as strengthening certain areas too. But one aspect is to encourage more flexibility of these areas that we found to be restricted. And an exercise in the neck region, for example, would be a forward and then a backward pulling sort of action, where you keep the head forward to help the joints to slide in that direction, then allow the muscles to work for a few moments, and then relax to neutral normal, and then do a pulling back type of action to get the joints to slide backwards and another group of muscles to do a bit of work, so they get in a bit better tone as well. We certainly make sure that our patients don't do big circular movements with the head, because we understand from the way the joints are built that there could be a grinding effect on those very delicate little joints in the neck. So there's good and there's also bad exercises, and that's most important for a patient to understand, especially depending on the type of spine they have. So certainly chiropractors have had to educate their patients a lot more in terms of the right and the wrong exercises, especially after the boom of the 80s, when the fitness was really, really important for everybody, and there was a lot of jarring and jolting, high impact type aerobics. That's pretty well a thing of the past now, and we believe that it should be a thing of the past as well, because trauma to the spine, shocking it, jolting it, jarring it, is not a very good idea in the long run. We should minimize that type of activity if we can. One of the most important things we find with lifting injuries is that most of the people who've hurt themselves doing that, they seem to hurt their lower back most of all, and they've thought that they've done the right thing at the time. They've bent down, they've been using their leg muscles, and they've been trying to keep their back reasonably straight. And most of us know that's a good idea. Where we have seen a lot of problems is that once a person has lifted that weight, one of two things can happen. It may be a little bit too far away from their body or their center of gravity, which would require them to lean even further forward and then strain their back. Or they end up turning with that weight before they've turned their feet. And that's a very important aspect. We try and educate our patients to turn the foot in the direction that their body is going to go first, bring the other foot along with that so it's parallel, and then they're pretty well in the right direction already, without having to swivel their lower back or create a grinding effect down in that lumbar spine while they're carrying that extra weight. Most people who actually come to chiropractors already have a symptom, and it's quite well established. Unfortunately, chiropractors are often seen as a last resort rather than a first resort. And that's a consequence, I think, of the way most of us think about our health. We tend to feel that if there's a symptom, we'll pay attention to our health, and if there's no symptoms at that particular moment in time, then we can forget about our health. We're obviously in good condition. Chiropractors look at it a little bit differently. We like to think that the body can look after itself as long as you help to look after it. But most people ignore even the little warning signals. And by the time they get those warning signals, we can have problems very well established, especially in the spine and the way it's functioning. So we would rather see people quite young in their life, if we can, to examine the way their spine functions. And much like a dentist would look at a child's teeth to see how they're performing, we would check a spine to make sure that it's functioning as well as possible. And if there is any restriction in that spine, gently, safely, effectively release the little bit of stiffness that could be there and allow it to function the way it's supposed to, so that that spine can grow up the way nature intended it to be. One point that we would like to stress is that chiropractors are involved in wellness. We are trying to lift our patients away from the sickness model that most people seem to think about when it comes to health. We'd rather have a person staying healthy than continually having to fix them up and to repair them, much like people do with their cars. So what we're trying to do is encourage people to take responsibility for their own health so they can look after themselves. Perhaps they have to see a chiropractor once in a while, like they have to see their dentist or perhaps any other sort of doctor. But a preventative approach seems to be the best way to get lasting results.
Thomas Edison, one of the most renowned scientists of former times, probably exemplified it best when he said, exemplified chiropractic philosophy best, when he said, the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. So this is in alignment with chiropractic philosophy, and in the 21st century, and even now, we're finding that if you can eliminate problems and correct them, correct the cause of the problem, without having to give drugs and perform surgery, although these things are necessary in certain cases, it's a very sophisticated and an efficient way of dealing with problems.
Chiropractic therapy is a unique and specialized treatment which has helped millions of people around the world preserve, recover, and prevent spinal and nerve-related problems. Today's chiropractor is safe, effective, and economical, and continues to become increasingly popular throughout the world.